Hello, this is Dr. Anton Fakhouri from Mid-America Hand to Shoulder Clinic to talk to you about dislocation of the PIP joint of the finger. The dislocation are often dorsal dislocation. Over 90% are dorsal dislocation, which means that the middle phalanx is dorsal to the proximal phalanx. So if we were to draw a if this is the PIP joint, the dislocation would be something like this, where the middle phalanx, and this is dorsal. Okay, so the reduction technique is one where first we do a digital block, either through a dorsal approach or a palmar approach, and you maintain some traction, and as I usually apply traction, maintain dorsal pressure from one of your fingers, and I apply traction, and then you flex the proximate flange joint to flexion. And once you reduce that, you need to maintain the finger in flexion. So you can ask your assistant to maintain the finger in flexion while you apply a splint. The splint should be in flexion. What I normally see is the patient comes back to our office after a reduction in an emergency or urgent care center with the splint applied in extension. Well, if you do that, then the joint will be predisposed to redislocation. So you bend the splint, let's say aluminum splint, apply the splint with the joint in flexion, apply tape distally and one proximally. And then, of course, they need follow-up within a few days, preferably within 2 or 3 days. And patient can, in fact, flex the PIP joint against the dorsal blocks. In other words, the PIP joint can be flexed without the risk of redislocation. It's just that the extension is what predisposes dislocation. So this is the dislocation of the PIP joint, dorsal dislocation. A palmar dislocation it has a different reduction technique in splinting, which we splint in extension. Many of these are stubborn in reduction and often require open reduction.